This is the continuation of the nervous system disease and mental illness PowerPoint narration for HIT 154. I am Alice Shapiro, your instructor. So here we are with the definition of mental illness and the definition of psychiatry and psychology. Either psychiatrists and or psychologists or social workers are involved in, and often other counselors are involved in the treatment of mental illness. So again, refers to a group of psychiatric disorders characterized by severe disturbances in thought, mood, and behavior. And psychiatry is a medical specialty, and psychology studies and treats abnormal versus normal behavior, generally by counseling methods. Psychologists generally do not prescribe drugs. They are not licensed to do so. Psychiatrists, being medical doctors, are. Mental illness affects 1/4 of people in our country. Many people suffering from mental illness may not appear that they are ill. Here are some of the warning signs of mental illness, including substance abuse, thoughts of suicide, withdrawal from family and friends, and as you see, this comes from the Diagnostic and Statistic Manual Text Revision number 4. All right, we're going to talk about a little bit about some selected disorders. ADHD is being more and more diagnosed and treated in our society today. Here are some factors about ADHD. It's a neurobiological condition characterized by symptoms of inattention and usually also including hyperactivity and impulsivity. It affects males more than females and can persist into adulthood. It is not just a childhood disease. There is evidence that there is genetic susceptibility, although heredity is not really, hasn't been confirmed as a factor, but it is implicated. So here are the DSM-4, the Manual of Mental Disorders, 4th edition, criteria describing ADHD. And this lists the subtypes. I'm not going to ask you what the different subtypes are, but I want you to be familiar with what the characteristics of these conditions are. All right, comorbidity means what are the other factors, illnesses, disturbances that go along with ADHD. As I mentioned, it is not limited to childhood, and it can, lifelong, if untreated, result in work failure, substance abuse, legal difficulties, car accidents, lack of attention, sexual indiscretions. It commonly occurs with depressive disorders and anxiety. The majority of children with this condition are effectively treated with stimulants. Again, stimulant medications are the oldest and most established pharmacological treatment of this disease. Behavior therapy is also used. Another disorder is autism. This also seems to be on the rise. We don't know if there is an environmental factor involved as well. These disorders include defects of language, social interactions, and sometimes repetitive stereotype behavior. It may be apparent in infancy, although sometimes it doesn't appear until after the age of 3. The causes include illnesses that result in central nervous system dysfunction, rubella, seizures, encephalitis, and, as I mentioned, perhaps toxins in our environment. And because it does occur concordantly in about 90% of identical twins, it is known then to be higher in families with a history of language-related disorders. Here are some of the symptoms. I want you to take a look at these. It is difficult for an autistic person to have direct eye contact. So if you will often find someone with autism just sort of gazing off away from you. Speech is often illogical and echo-like, although there are degrees of autism, anywhere from mild autism, sometimes just called autism syndrome disorder, to more severe. So there is a continuum. There may be repetitive and stereotypic behaviors, hand flapping, sometimes self-injurious behaviors such as head banging, abnormal patterns of eating, mood changes. Treatment includes medication, behavior modification, occupational and speech therapy. And if a parent is well informed, of course, there is a better outcome. Alzheimer's disease, we took a look at it before as a brain nervous system disorder, but now let's take a look at some of the mental disorders. Because there is degeneration of neurons, of course there will be changes in behavior. When the disease is severe, judgment is lost, personal care is neglected, physical illness may lead ultimately to death. There is often aggression and profound personality changes. And this tells you some of the factors, the abnormal collection, I should say, of neurofibrillary tangles. And these are detected in brain scans, although, as I mentioned, total diagnosis of the disease is not able to be done until autopsy to identify the plaques in the brain. So here there are some neurotransmitter disorders that occur, alterations. The risk factor, the most predominant risk factor, is advanced age and also family history. Most of the people with Alzheimer's disease are over 85 years of age, and it is 25 to 30% of that age group does suffer from that disease. There may be mutations in chromosomes. Again, this is not always the case, but it is associated with greater risk. Treatment, medications to slow the progression, antidepressants, anti-anxiety. All right, let's move on to substance use disorders, drug and alcohol abuse and addiction. This is a social problem with emotional and economic consequences. Obviously, these people often make bad choices, harm their health, their relationships, and sometimes put other people in danger. Treatment is medical, psychological, and social. We need to understand that it is a relapsing illness and that an individual needs to commit to lifetime treatment. Sometimes 12-step programs such as Alcoholics Anonymous are helpful, but they need to be continued. Bipolar disorder, also has been called manic depressive disorder, is a mood disorder involving huge shifts in personality from depression to mania. Highs and lows are often called the episodes of mania and depression. It affects more than 2 million adult Americans. Here are some of the symptoms of mania: heightened mood, exaggerated optimism, and extreme energy. A person in a manic phase of bipolar disorder who is untreated may stay awake for many, many hours or days, and reckless behavior. There are categories. I'm not going to ask you to learn the different categories, but to rather understand the disease overall, that it is a cyclic change from depression to mania. It could be genetic, biochemical, and environmental, or any or all of these. It does run in families, and stressful experiences may trigger some of the symptoms. And it may be that the neurotransmitters are disturbed because of the presence of another illness. So each case really is individual, and I do have some short films about bipolar disorder on the Moodle page for you to look at. Treatment requires medication, antidepressants, sleep aids, tranquilizers, antipsychotic, and also counseling will help. PTSD, again, with so many people returning from so many wars, we do have PTSD occurring quite frequently in our population, and I think many of you understand the symptoms and signs of this. A person may lose interest in events that were often, before their experience, were joyful for them. People with PTSD often feel guilty about surviving, and they often have flashbacks in which they relive their traumatic experiences. Eating disorders include, we're going to take a look at bulimia and anorexia. We do have extreme attitudes surrounding weight and food in our society. Here's anorexia. Anorexia literally means without appetite. I want you to read and take a look at what some of the signs and symptoms are. And I think I will allow you to go back and look at these, or encourage you, I should say. You're always allowed to encourage you to go back and look at these, because I do want to finish up in the remaining about 3.5 minutes. Bulimia is binging and purging. Sometimes people force themselves to vomit when they suffer from this condition, or take laxatives, abuse laxatives. There are medical consequences, as you can imagine, from both anorexia. Anorexia can result in heart failure and death. Bulimia, since there is vomiting or abuse of laxatives, may lower blood potassium levels, cause muscle cramping, abnormal heart rhythms, cardiac arrest may result because of potassium loss. Also, the enamel of the teeth becomes eroded from vomiting acidic contents. Here's some more medical consequences. You could damage the bowel, and there are feelings of intense shame and guilt. And these people who are suffering from anorexia, the people who are suffering, from bulimia, may suffer from depression and alcohol or drug abuse. All right, so here are some of the psychological factors: troubled family relations, low self-esteem, thinking that by conforming to a certain body or beauty type, they could achieve happiness, let us say. All right. Biological basis of eating is very complex. It involves the hypothalamus, the limbic system, the prefrontal lobes of the brain. So these are very complex disorders, both biological and psychological. Treatments, medical treatment, and group, family, and individual therapy, not just nutritional counseling, but psychological therapy, sometimes family therapy as well. Suicide, here are some of the signs and symptoms. The risks include substance abuse, previous attempts. It occurs most often when people experience major loss or stressful events. Here are some of the warning signs. They may talk about their distress. They may talk about isolation. They may be withdrawn, talk of death, give away possessions. So be on the alert for some of these. All right, there are diagnostic tests for mental illness in general, which include medical history and patient history, including their behaviors. Observation of patient alone and or with family. It's best to do both. And standardized written questionnaires can be used. And then I want you to go to Moodle to review and look at some of these or all of these films, please. They're short films. Again, I hope your studying is successful, and contact me as soon as any issues arise, and I will be able to answer any more questions that you may have. All right, this is the end of this video, and I'll be chatting with you again soon.